Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, the Chief Medical Officer of Health for Alberta. Dr. Hinshaw will provide brief remarks, and then we will open the floor to questions.
Thank you, Tom, and good afternoon. Today, I would like to share the latest numbers on COVID-19 and provide an update on testing in the province. First, I'd like to talk about the outbreak at Good Samaritan Society's Southgate Care Centre. At my last media availability, I incorrectly stated that AHS had taken over operations at the facility. This was due to a miscommunication between some of our staff. I apologize if there was any confusion. Sadly, I must report 5 new deaths today, all of them at the Good Samaritan Southgate Care Centre. There have now been 21 deaths at this outbreak. This is a stark example of the devastation this virus can cause. I want to offer my condolences to the families and friends of these individuals and to all who have lost loved ones during this time when our grieving processes are altered by COVID-19 restrictions. We are taking this outbreak extremely seriously. As with any outbreak, health officials have considered any and all possible options to protect the health of residents. An order to take over operations is a step that is not taken lightly and occurs only when a facility is not able to fully comply with the mandatory orders we have in place. This has not been the case here. Alberta Health Services has been working very closely with the Good Samaritan Society to monitor staffing levels. AHS now has nursing and management staff on the site. My colleagues are meeting with the facility daily to make sure that everything possible is being done to support residents and staff. I have been assured that all mandatory outbreak protocols are in place. This includes screening and temperature checks twice a day, widespread testing, and enhanced cleaning. This is a difficult situation, but local officials are doing everything possible to support all those who are involved. We will continue to closely monitor the outbreak and take whatever steps are needed to support the health of residents and staff. Across the province, there are currently 91 people in hospital, 18 of whom are in intensive care. We conducted almost 8,700 new tests yesterday and identified 113 additional cases in the province. To date, more than 676,000 tests have been performed on more than 566,000 people. We are working hard to reduce wait times for tests and speed up the time it takes to get results. I'd like to remind people that in order to get results quickly, one option is to sign up for the My Health records online so you can see results as soon as they are available. Alberta Health Services has begun deploying more staff to assessment centres, extending the hours to meet increased demand, and is hiring more staff for the fall. We are also looking at other innovative ways to make it easy for more Albertans to safely access testing. That's why I'm pleased to announce today that Alberta is now expanding COVID-19 testing in community pharmacies. Last month, as you know, we began a pilot project to provide people with asymptomatic testing at a small group of community pharmacies. This pilot was initially kept small to allow us to refine the process involved in working with the pharmacies, collecting swabs, and transporting and testing the samples. This project was a success. More than 10,000 people were safely tested at the pilot pharmacies in the last month. Based on this success, we're expanding the program to any pharmacy that wants to offer testing and is able to meet the safety requirements. Testing can begin as soon as the pharmacy is enrolled and receives the necessary test supplies from Alberta Precision Labs. I have heard that many are excited to access testing closer to home, and many pharmacies are looking forward to providing this critical service. However, I am asking Albertans to be patient for the first few weeks. Pharmacies will need to complete an enrollment process to ensure patient safety and efficient distribution of supplies. It may take pharmacies in your area a little bit of time to enroll and begin testing. Some pharmacies may choose not to participate, and that's okay too. This program is voluntary. AHS continues to offer testing across the province and, as I mentioned earlier, is working to reduce wait times. A list of all the pharmacies that are providing testing is now available online. To find out if your local pharmacy offers testing, You can visit the Alberta Blue Cross website and click on the COVID-19 banner at the top of the page. We encourage you to check back there often. The list will be updated frequently as more pharmacies are enrolled in the program. To arrange for testing, check with your local pharmacy about the process they are using to sign people up. And please remember, for the safety of yourself and others, only people with no symptoms and no known exposure to COVID-19 can be tested at a pharmacy. If you have symptoms or if you know that you've been exposed, please book testing through AHS, through the online assessment tool, or by calling 811. I know that many Albertans are also keenly interested in serology testing, so I would like to update you on the targeted research studies announced last month. As a reminder, serology testing is different from the swab testing that is offered by AHS and community pharmacies. Serology testing detects antibodies in the blood from COVID-19. This can help us understand how many people were previously infected with COVID-19. It does not tell us if someone is currently sick or contagious, and a positive serology test does not guarantee immunity from the virus. That is why these tests are not being offered at an individual level, but rather at a population level, because it can tell us more about how the virus has spread in the population and help us improve Alberta's response. We have now received the first estimates from the COVID-19 residual sera study being done by Alberta Precision Laboratories. Our labs have analyzed nearly 9,400 anonymous randomized samples from blood tests that were collected for other clinical reasons during the first week in June. This provides a baseline estimate of how many Albertans had antibodies for COVID-19 at that point in time, reflecting infections that would have happened before the middle of May. This is important because, as with any virus, many people may not have been aware that they had COVID-19 or not gotten tested for it, especially in early spring before testing was widely available across Alberta. Of the samples from early June, less than 1% showed the presence of antibodies. It is important to note this was not necessarily a representative sample of the population, but it gives us an approximate idea of how many infections there have been, at least in a group that was seeking health care. Even with these limitations, if we take this percentage and apply it to the general population as an estimate, we calculate that there were almost 36,000 COVID-19 cases in Alberta as of May 20th, while as of that date, we had identified just over 6,000 cases through swab testing. We are using the date of May 20th as it takes approximately 2 weeks for antibodies to be reliably detected after an infection, and the blood samples were drawn in early June. This indicates that Alberta's testing program had at that point identified about 17% of cases in the population. I know this number may sound low, but it's actually very good. Let me put these numbers into context. British Columbia's serological study results, released last week, show about 12.5% of estimated cases by May were identified by swab testing. Similar serosurveys in California, Spain, and Sweden indicate between 1.3% and 9.7% of cases were identified by swab testing. This data is an indication that our current PCR testing program is highly effective and is identifying a higher percentage of actual cases than programs in many other jurisdictions. Along with the data on case numbers and hospitalizations, this indicates that Alberta's early efforts to flatten the curve and limit the spread of COVID-19 were successful. The other thing this tells us is that as of mid-May, a very low percentage of our population had been infected with COVID-19. It is still early days for this study. While these are not definitive conclusions, they do provide a valuable starting point and new insight into cases in Alberta. The study will be repeated monthly, so we can see changes in antibody prevalence as restrictions lift and time progresses. Further analysis of the June data and upcoming data from July will inform our public health response and any testing strategy adjustments that we need to make this fall. I look forward to providing further updates as new information becomes available. Another topic that I know is of great interest to Albertans is the discussion around masks in schools. As I mentioned last week, masking is not currently mandatory, but there is still a lot of evidence from international sources and other jurisdictions that we are carefully reviewing. Our guidance will be updated in the coming weeks when we complete this evidence review. We are coming up on the August long weekend, and I know that people are excited to get outside. But we must keep in mind that after Canada Day, we saw several events that resulted in the spread of COVID-19 amongst friends and families. This is not the only reason that our case numbers have risen, but it has played a part. I would like to encourage all Albertans to take precautions when celebrating this weekend. We all want to socialize and make happy, positive memories. I am confident that none of us want to have those memories spoiled with a loved one getting sick or friends and family having to isolate because we didn't take simple precautions. I know many people are tired of being told what they can't do. Instead, this weekend, let's all think about the things we can do and how to do it safely. We can enjoy camping, going to a restaurant, having a barbecue, watching a hockey game with friends and family, or visiting a loved one at a continuing care facility. To do these things, we just need to make a few adjustments to make sure we're following public health guidance to the best of our ability. If you go camping or to the beach, please respect the health and safety of small communities along the way by planning trips with limited stops for gas or food. Have a backup plan if your planned destination is too crowded when you get there. When planning the amount of people you want to have over for dinner or an NHL viewing party, plan for an outdoor gathering if possible. Think about how many people would comfortably fit 2 meters apart and stick to that maximum number. If you go to a party, help the host out by following the guidance and helping them keep everyone safe. Protect loved ones by encouraging everyone to bring their own food and drinks and use their own utensils. Follow all facility policies when visiting a loved one in continuing care, and allow time for completing screening before visiting. Make sure your loved one is in the caring hands of staff before you leave. Wherever you go, physically distance, wear a mask in crowded places, and wash your hands. Be a champion for safety and speak up if others are unsure on how to follow public health guidance. And while it may be disappointing, the greatest thing you can do for all of our loved ones is to stay home if you are feeling unwell and arrange for testing. Only by observing these measures can we all help prevent the spread while staying socially connected this August long weekend and beyond. COVID-19 will not take a break because it is a holiday. Careless behavior today can lead to sharp increases in cases next week and the week after. I know there are many Albertans out there who feel alone or anxious, or who are unable to go out because they are at high risk of severe outcomes. I encourage every one of us to reach out to members of the community who may be in this position. Text, call, or email your friends or family who are limiting their time with others because they are at higher risk. To close, I would like to wish all Albertans a happy and healthy long weekend. Be wise, be safe, and let's all look out for each other. Thank you, and I'd be happy to answer whatever questions you have.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
First is James Keller with the Globe and Mail. Go ahead, James.
Hi there. I'm just back to the school issue. I'm wondering, we're looking at other provinces, and they've had measures to reduce the class sizes and keep people separate in ways that are not happening in Alberta. So I'm wondering, why did this province not take a similar route to allow for physical distancing and reduce crowding? And what is your expectation as far as disruptions once schools are up and running? We had a case in Calgary with a student that fell ill, and the whole class was put into self-isolation. Is that something that we should be expecting when the full school program resumes in the fall?
As we see the plans rolling out in different provinces, certainly some of them have taken a slightly different approach than Alberta, but I think there are many similarities across the different jurisdictions. You note that BC has a cohort model similar to the model that we're adopting in Alberta, and the cohort sizes are in fact somewhat larger than what we have adopted. What's really important to remember is, as I said last week and again today, we are looking at the evidence around back to school, around the different public health measures that have been successful in other jurisdictions, and we are working on an update to our public health guidance. And we did mention that last week when we announced the back to school plan, that guidance was under revision, and we anticipate that will be complete in the coming weeks. So we had gone to we'd gone out with the plans that were available at that time, but again, that evidence summary hadn't quite been finished by our teams, and so you can anticipate some upcoming changes in the coming weeks to that guidance. With respect to disruption in classes, if there is a case, with any case, we would do an assessment to determine who had been in close contact with that person while they were considered infectious, and those who were in close contact would then have to be home for 14 days. And so, as in the case in Calgary, that could, in some cases, mean that the entire class would potentially have to be in quarantine for 14 days. In other cases, there may only be a few people who would be considered close contacts, so it really depends on the context and how people are interacting with each other as to how many people would end up needing to self-isolate for that 14-day time period.
All right, operator, could you put through the next one, please?
Next is Jason Herring with the Gauntlet. Go ahead, Jason.
Hi there, Dr. Henshaw. Municipalities across Alberta have been debating mandatory mask bylaws over the past few weeks, with some of them introducing new mandates and others foregoing them entirely. Many mayors of these municipalities have talked about how they're annoyed that the decisions have fallen to them. Why is the province making municipal councils comprised of elected officials who largely don't have any medical experience make these public health decisions? As well, can you confirm whether you, at any point, have recommended to the government that a provincial mask mandate be introduced?
Thank you for the question. So the question of municipalities versus provincial mandates, the important thing to note, first of all, is that I support mask wearing. I believe that the evidence indicates that it is an important addition to, not a replacement of, public health guidance that limits the spread of COVID-19, particularly in indoor spaces and in spaces where people are not consistently 2 meters from each other. And that has been a clear statement for many weeks since the evidence began to accumulate to demonstrate that there was an increased benefit to masking. The question of whether or not it should be mandatory is, I think, a separate question. And I would say that we know that there's different levels of COVID spread and COVID risk in different municipalities and different local areas across the province. And the opportunity for municipalities to consider their local context and proceed as they deem fit is part of the legislative framework. And with respect to public health advice, again, I think the public health advice is clear that masking is an important addition. It's strongly recommended, and masks have been provided by the provincial government. So I think that, again, the question of the mandatory or not really is up to areas who feel that their local epidemiology, their local risk, their local spread is causing them to want to have that discussion and go down that path. That's certainly within their ability to do so. And at a provincial level, we strongly recommend that masks are used, masks have been provided. And as I mentioned, in certain specific contexts, such as schools, we are assessing the evidence relevant to masks in that particular context. I feel like there was another part to the question that I didn't answer.
If so, Jason, we'll definitely follow up after. I apologize, I lost it. I think there was 3 in there. Operator, could you put through the next one, please?
This is Rafi Bouchakanian with CBC. Go ahead, Rafi.
Hi, thanks very much, Dr. Henshaw. I was curious about why at the Good Samaritan, given that the number of deaths has nearly doubled in a week, we've gone from 9 on Friday to 21, more than double, I should say. Why have they not conducted asymptomatic swabbing of residents since last week? And I will actually re-ask Jason's other question, which I believe was, have you personally ever recommended making masks mandatory to the provincial government in your advice?
Thank you. With respect to the Good Samaritan and the frequency of asymptomatic swabbing, that's something that's determined at the local level, whereas that local public health team and local site management team are looking at what's needed. We know that with an exposure event, it can take up to 14 days for cases to be diagnosed, and we also know that once somebody does become ill with COVID-19, unfortunately, for people who are frail or older, who have multiple medical conditions, that they are at higher risk of these severe outcomes. So I would say that definitively without question, this is a tragic event. And as I mentioned earlier, everything is being done to limit the spread. And the frequency of asymptomatic testing, again, is something that local site determines based on how they're seeing that unfold. But anyone who's a close contact, those at the site, are all being managed to prevent the spread of COVID-19. And testing is only one additional element to that. There's many other elements to outbreak response that are undertaken and are in place independent of the testing. So the frequency of that testing, again, is only one element. With respect to the recommendation, again, as I've said, I have recommended and continue to recommend that Albertans wear masks when in crowded spaces, when in public indoor places where that distance is not able to be kept. With respect to those policy discussions, again, I think those are complex discussions, and my position has always been, since the evidence has become clearer on this, that masking is an important intervention, and that we are doing everything we can to encourage Albertans with respect to taking this up, to using the masks that have been distributed and considering other options. As I mentioned on Monday, there is also the possibility of using masks as a fashion accessory. While that may be somewhat frivolous, there's so much to COVID-19 that is difficult and gloomy. I think where we can have a little bit of fun, we should try to do that.
Operator, could you put through the next question, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. You say Good Samaritan Southgate is able to comply with the mandatory orders, but that outbreak is growing and the death toll is rising quickly. So why not just take over the day-to-day operations of the site? What would be the downside to that? Also, what are some of the other options that health officials have when it comes to Good Samaritan Southgate? And also, just lastly, now that there are these early serology study results, should the province have expanded testing to all Albertans earlier?
The question about the Good Samaritan Southgate we'll have to take back to our compliance team. So I'm not involved in the day-to-day discussions on specific outbreak management. And so I can't speak to the pros and cons. What I can say is that as of late last week, Alberta Health Services did offer significant additional support to this particular facility to make sure that they did have everything they needed. And so the question of whether or not Alberta Health Services should take over the site versus offering this support, again, those weren't conversations I was a part of, so we'll have to get back to you on that particular piece of your question. But as I mentioned, AHS is involved. They have management and nursing teams on site, and all support that is needed is currently being provided. With respect to the question of the serology test results, I think you'll recall that early on in the pandemic, this, of course, was a brand new virus. It was something that we needed to work on testing capacity, and Alberta was an early leader in the number of tests we were able to process per day. At the beginning of the pandemic, we, along with every other jurisdiction in the country, were still building our testing capacity. We had to do evaluation and verification of our testing processes, and a lot of the methods were novel and again being tested. We were the first province to be able to test all returning travelers without specifying a particular destination, and we did use our capacity that was available at that time to target those who were at highest risk, first returning travelers, and then we moved, of course, to healthcare workers, continuing care, and other people who were at high risk. And as soon as we had the lab capacity available to move to PCR testing, we did expand to include all Albertans, first all symptomatic Albertans, and later all asymptomatic Albertans as well. So that question of whether or not there would have been value in testing more Albertans, I think the answer is that we had significant volumes earlier than many other provinces and other countries around the world, and that we offered as much testing as we could within the resources that we had at that time. And I'll repeat again that I think it's encouraging that the percentage of the tests, that it seems that we detected about 17% of our cases if you look at our serology results, which is actually higher than almost any other jurisdiction in the world when they've done their serology scans. Most are in the range of about 10%. So I think that's encouraging.
All right, it's almost 4 p.m., so we'll take 3 more questions. Operator, could you put through the next one, please?
Next is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. With all due respect, I don't think you actually answered the question from my colleague, so I'm going to ask it again. Have you ever recommended to the province that masks be made mandatory? Yes or no?
I have never brought forward a formal recommendation for a province-wide mandatory mask policy.
All right, Operator, could you put through the next one, please?
Next is Jenna Freeman with Global TV Calgary. Go ahead, Jenna.
Hi there. Just wondering if there's a threshold when we come to numbers in terms of whether we would go back to phase 1 and what that would look like, whether it would be a full scale back. And on that note, are we ever going to get to stage 3, and is there a timeline for that?
The triggers that we've talked about with respect to stage 1, 2, and 3 have been our hospitalization and our ICU metrics. With respect to moving forward or moving back, we're currently seeing that our hospitalization and ICU are higher than they have been, and they're also relatively stable over the past 4 to 5 days. We're watching those things very closely to determine the need to change any of our current relaunch framework. If we did need to go back, so to speak, or impose new measures, that would be done, again, based on looking at those metrics, based on looking at where areas of risk might be, where spread is happening, both looking if there's particular geographic areas, as well as looking at where transmission is happening, what types of settings the transmission is happening in. At the moment, our focus is on ensuring that all operators of any facility, whether it's a business or a place that offers activities to the public, that they're aware of and following our public health guidance, because it wouldn't do much good to change our measures if they're not being followed anyways. So our current measures and the current guidance are able to limit the spread if they're being followed, and so that's something that we're working on right now, is proactively ensuring that all operators understand the requirements under the current framework and that they're able to follow those, and therefore moving into the reduction in case transmission based on that is our current goal. There was a second part.
Not sure.
Sorry, I need to bring a pen with me.
Operator, could you put through the final question, please?
Final question is Dylan Short with the Edmonton Journal. Go ahead, Dylan.
Hi, Dr. Hinshaw. At 21 deaths, the Good Samaritan outbreak is now up there with what we saw out of the Mackenzie Town outbreak earlier in the pandemic. I was just wondering, this comes at a time when we had heard that things had sort of shifted out of long-term care. I was just wondering if there's lessons that were learned at the Mackenzie Town that may have been missed at Good Samaritan or that we're now using to help get this outbreak back under control, and if there are, what are some of those, lessons learned from the first one?
There is work underway to articulate those lessons from Mackenzie Town. I have not seen a final report on that particular outbreak. What I know is that what we've seen, not just in that one, but in other outbreaks in continuing care where we've seen significant spread, one of the common themes is a significant challenge in units that have patients with significant cognitive impairment or dementia, where it's extremely difficult to keep patients, especially those who either have been exposed to a case or who are infected. Those particular individuals, it's extremely difficult to help them understand, because of their cognitive impairment, the need to be restrained and isolated in their room, and that they can't be out and about with others. And that particular element of particular wings with individuals who have that diagnosis is something that we've seen in many sites as being a challenge once there is an exposure in that particular population. And we are working to understand what are the interventions that are both things that take into account the needs of those individuals and not taking away their freedoms or their needs, but at the same time trying to think about ways that those individuals can potentially be more effectively kept from infecting others if they themselves are infected or exposed. So I think that's one of the key issues that we continue to work on, and I think other lessons learned will come once we have these final reports.
All right, thank you all for joining us. Dr. Hinshaw will provide another update on Tuesday after the long weekend.